Welcome to the Vegan Family Kitchen podcast. I have a special guest today, my friend Charlyn Black. Hi, Charlyn.
Hello.
It is an honor to have you on the podcast because we've known each other for a few years now. I'd say maybe 4 years, but we've never had this in-depth conversation, and I thought it would be interesting for everyone to listen to it as well. I will briefly introduce you, but we're going to go back to talking about your professional journey in a moment. You are a family doctor by training, though you no longer practice. You obtained your medical degree from the University of Manitoba, and you continued into a little later doctorate from Johns Hopkins University in health policy. That was a little bit later in the 1980s. You are now a university professor here at the University of British Columbia in the School of Population and Public Health. You have forever been interested in prevention. And as a physician, one of your key goals was always to help your patients stay away from the doctor. And that is definitely where we get along because I think it is key to staying healthy in so many ways. Nothing against doctor. I live with one.
Nor me. When we need them, hopefully when we need them, they're there.
Exactly. But avoiding needing them is the start in so many ways. You have also been vegetarian since the 1980s. And in recent years, you made a turn toward a whole foods plant-based diet. This is going to be a super interesting conversation. Thank you for being here.
Thank you for having me.
I'd like to start by asking you about your plant-based journey. Let's start there. How did it happen to you that you came to this stage in your approach to nutrition, cooking, and eating?
So I'm going to start a little more broadly with that focus on prevention. You know, as a teenager, my mom had bad arthritis, and she started doing yoga, and her arthritis got better. So I became a yoga teacher at the tender age of 16 years and was really interested in seeing people get healthier and better with my yoga practice. I went into medicine many years ago when that was a very crazy idea, with the idea that I might combine yoga and medicine, but being an early cohort of female doctors, that didn't work so well. So I had to be really good at medicine. So I initially had a role training other physicians. I've always been interested in teaching. So early on, I read Frances Moore Lapé's book, Diet for a Small Planet, and that really influenced me and shifted me towards a vegetarian, what I thought was a healthier vegetarian diet and one that was easier on the planet. So, but it wasn't until about 2018 when I finally watched Forks Over Knives that it hit me that a whole food plant-based diet is really so much better for our health. And so I'd say since that time, I've become really, really interested. I've incorporated it into my life and explored other related kinds of issues. You know, with my academic background, I have the opportunity to dig into the literature and to even do some things to deepen my understanding and practice. So I can give you a couple of examples of things I've done this year. What I call my anthropological personal research in my personal journey.
I love it.
Earlier, in 2022, I visited Alan Goldhammer's shop, True North Health Center, where they do water fasting to prevent and reverse disease. And I myself did a 7-day water fast and a 7-day refeed. Wonderful experience. Little challenging. That 7-day water fast was challenging, and it's under medical supervision. So this was really me learning about how do some of these practitioners really oversee not only prevention, but reversal of disease. Another thing I did was I just recently did a retreat with Rip Esselstyn, with the Esselstyns, and took a friend with me and really got inspired again about, deepening my commitment to my whole food plant-based diet.
And if I can put it that way, you don't come at this from a place of poor health, and you're a very healthy person. Is that correct?
Absolutely.
Right.
Absolutely. Yeah.
And that's something that has been interesting for me, because I think a lot of the focus on health has been focus on disease reversal, obviously, and it is a massive problem in North America and increasingly the world. We're dealing with chronic disease, diabetes, and heart disease of all kinds.
Right.
But a little bit like you, I came, perhaps because I started younger, I came to plant-based, mostly whole foods when I was in my mid-30s. My husband and I were quite athletic. We didn't have any health problem. We didn't have extra weight we were carrying around, really. So sometimes when I'm asked a question, well, did you experience any health benefits, from going plant-based? I'm like, well, no, but it's staying good, which I figure is a benefit. Right. How do you see that for yourself?
Well, it's really interesting because understanding the range of health conditions and the early markers of poor health, because we have a deeper understanding, I think, from a medical and a biological perspective about early markers of these conditions. They take years to develop. So I, have had more weight on in the past. And I'd say since I started my plant-based, my whole food plant-based journey, I've lost about 20 pounds. So that's a health benefit for sure. I don't know that I know what my markers were, but, I think that there are subtle things that we may not understand, but that the health benefits and the health transitions are there for many people. So I would say I have felt a benefit. I've included some more exercise with my transition, and I'm really seeing the benefits from both of those commitments.
That's really fantastic. I think you're a very vital person. And when I talk in depth with people, often I hear, because I mentioned to you this other podcast about being in your 40s. And I often hear, oh, in your 40s, your body kind of starts to fail you. Right. And I
just wait till you're 60s.
Exactly. But at the same time, I love hearing those stories that are a little bit of the opposite. Actually, I'm feeling really good and I'm exercising more. And it's not a destiny. I'm not saying that people all will be getting personal best marathon times in their 80s. That's not what I'm saying. But it is, decay is not a dark fate that hangs over us necessarily, and that we have no control over whatsoever.
Right. I mean, in the scientific literature, there is a discussion about, are we extending our lives, and are we extending our lives in good health? And how do we maximize the in good health part with higher quality of life for the longest period of time? And so that healthy aging is another theme that I'm really interested in.
Yes, because sadly, my father passed away from Alzheimer's disease a couple of years ago, and I've seen a lot of other people aging not so gracefully. And yes, you may live until 85, or 95, but it's not always in the most pleasant of circumstances.
Right. How do you want to spend those years?
Exactly. And how much control do you want to have over your life?
Yeah. Well, I think there is research that tells us that we have powerful choices to make in our lives. So we'll get into, from a professional perspective, I think, it's not always up to us as individuals. I think there are things that society policy changes that can be made. And obviously, with a background in public health, I'm interested in how do we make those choices easier for people and support people. One physician I heard give a talk said that we almost need a Formula One team around every individual to support them. Well, can we build healthier environments, right? Can we make it easy to make good choices and to
Yes.
help us stay healthy? So
yes, totally. Let's go into that because, as you say, I was going to jump in and say, well, if we're able to make those choices, and those of us that can do those choices, of course, should jump right in. But what about everybody else, right? And so let's talk about where your plant-based journey intersects with your professional trajectory in the last few years.
right, because I'd say that until recently, they've been separate streams.
Okay.
At this stage in life, as I approach retirement, I'm really wanting to jump in to this area and go back to my initial passion of prevention. And so we know in public health that, maybe 15% of our health is related to the medical care we receive, and the rest is related to our social determinants of health. One of the major ones, I think, is food. And, I think Michael Pollan's statement, eat food, real food, not too much, is so relevant here. And there's so much more research now talking about the role of nutrition. There's an EAT Lancet report that talks about food and nutrition as the most powerful influences on both human and planetary health. So we really have an opportunity to make choices that not only benefit us, but benefit other people. But there are real challenges in prevention, and I think you alluded to them. How do we make things work for everybody? Because typically there are challenges when we focus just on health promotion, on educating people. It's people who are already healthy who respond. How do we, in public health, really influence those who are most disadvantaged, who have the most significant challenges with food and nutrition? And I think that's where community-based programs, focused, targeted interventions, even educating medical people and health professionals can make a difference. Maybe we can get more of this into regular advice, support for people. So there are so many different ways we can influence the choices that individuals make at so many different levels, be it clinical, be it programmatic, community-based programs, be it podcasts like yours, be it. So there are just so many different avenues to have an influence here. And so one of the things I'm just getting ready to do that is I'll be teaching a course on chronic disease, this starting next week, for graduate students in the school. And so I really do hope to influence some next public health practitioners and researchers about these messages. And I also will be teaching a course on policy responses to the social determinants of health. How do we really influence things like housing, nutrition policy, food and nutrition policy, income inequality, things that really create huge differentials in how healthy we are across the Canadian population.
I'm going to ask you a little later how you make your diet choices work for you, because you're approaching retirement, but still a pretty busy person. And often we hear people say, oh, I'm too busy to eat well, stuff like that. So we'll go back to that in a moment. But since we're on the topic of policy, I'd like you to give me a little bit of hope, because frankly, when I look all around me, I'm not often seeing a whole lot of hopeful signs. In particular, you mentioned physicians integrating maybe lifestyle, advice kind of thing into their practice more. And I was thinking, just have them stop saying bad things like, gastroenterologists that may tell their patients, oh, it has nothing to do with diet, which, for the love of God, please. So give me hope. Tell me about initiatives that are happening that are going in the right direction, in your opinion, at the moment.
Well, my guess is that the people who are most likely to take up these messages are our young students. Unfortunately, I think it's really challenging to bring this influence to the current leaders in developing medical curricula, that kind of thing. In spite of that, I see different initiatives. There are initiatives in culinary medicine, where, for instance, and this is one thing that I'm hoping to bring to UBC, to offer a course to interested students in health professional training programs, to bring them in to a teaching kitchen and help them learn how to cook differently, how to cook healthy plant-based food, and to incorporate the medical and learning there. So there are actually curricula that exist on the web that can be adopted and adapted. So maybe with a little bit of help, I can get one of those launched. I really think that working with medical students and having them advocate for change is really going to be the best way to move this forward. I think if there are calls from students, our younger generation, I think, is much more in tune with these messages and willing to make these kinds of changes in their lives. So my hope comes from focusing on the up and coming generation and seeing if we can. Now, I will say that there are initiatives, medical practices here in BC even, that are taking this up. And there are several that I really, in my earlier life, I really focused on health services research, which looks at the relationship between health and healthcare delivery, patterns of healthcare delivery. And I really think that to really make this work, we need different payment mechanisms for doctors, that kind of thing. So, policy, both in terms of medical care, disease management care, I call it, and at national and provincial levels, I think is really critical here. In the food and nutrition lecture I gave in the policy course, it became really clear that, the Health Canada has a real mandate to help us adopt the Canada Food Guide, which is very aligned with what you and I are interested in. However, developing a food policy is under the Department of Agriculture. And so there are going to be conflicts there because industry is highly represented. So and I think this is the challenge of many public health initiatives, tobacco, so many others, is, finding a way to get the messages out to counter the confusion that's deliberately sowed by industry to make our messaging that much more challenging.
Indeed. I'd like to talk a little bit about another topic we've talked about before, which is are there initiatives that you know of or that maybe are going to come to fruition in the not too distant future that would be more helpful for those who are experiencing housing insecurity, financial insecurity, living in substandard condition? I mean, when you think of the people that would benefit the most from, a bolus of blueberries, of fresh fruit and a lot of more vegetables and for their health, for their energy, for all those reasons, from whole grains, from legumes,
right?
They are often, unfortunately, those that have the least means of even cooking for themselves or spending a moment thinking about, like, even if you want to change your diet, when you live with several forms of insecurity and discrimination and whatnot, like even spending a moment to think about making major changes to your diet, it's just overwhelming. The conditions are not there. Like, is there anything coming up that we may be cheering for and supporting?
I think that there are initiatives underway to introduce healthy school lunch programs, which I would hope that everyone listening to your podcast would be very much in favor of. There's a challenge with these, that they're often industry influenced, but hopefully we can ensure that any programs that are advanced are really based on the Canada Food Guide. So that's one initiative.
And I got to say, in Canada, there's not school lunch quite at the same scale as there is in the United States, at least in British Columbia. There's very little.
Right. Well, in fact, Canada's one of the few OECD countries that does not have school lunch programs. So there's a real disparity there that we could address, that would have a huge impact on children who come from lower income families.
And maybe we could leapfrog the corn dogs and
hopefully
hot dog part of the school lunch. If we just start the right way, wouldn't that be good?
Let's start the right way. Well, because our Canada Food Guide was quite innovative in that they really excluded industry partners from being at the table. Up until the most recent one, industry partners had played a huge role. So the Canada Food Guide is seen as very, very advanced. I know that nationally, Health Canada is working on nutrition labeling. I'm a little worried that it's just focused on labeling bad things, which I don't know how well it will help people focus on healthy food. We know that healthy food is mostly unprocessed around the edges of the supermarket, but not in the meat or dairy section. And so how we move beyond labels on things that are processed, I think is a challenge. So that's one. The other, there's been recent change in funding to primary care in BC, and I'm curious to see if that will support more integration of different types of practitioners, especially dietitians, etc. But then I have a question for you about how many dietitians really understand plant-based?
Well, I mean, unfortunately, schools where dietetics, registered dietitians are trained have been also heavily, let's say, partnered with the dairy industry in Canada.
Absolutely.
And this remains, I think, the number one hurdle to break. Even the Canadian Association of Dietitians has a partnership still with the Dairy Association, which is unfathomable. How is that even possible that they would be sponsored by one of the worst industries out there?
Well, and that's what I think is something that needs to happen, is to have the public made more aware of these industry influences, because they're pervasive, they're everywhere. But, and so much of the confusion around dietary advice, I mean, we've known since the 70s that eating more fruits, vegetables is better for us. But that information has been suppressed, or actively suppressed. I'm just finally reading Colin Campbell's The China Study, and to read about some of the active suppression of that early research is scary. It's so pervasive.
It is. And the continued obfuscation, I think we can use that word, that is purposefully thrown in to the research, just as you mentioned earlier, to seed doubt.
Exactly.
Right. And at the end of the day, something that bugs me. So I've mentioned I'm married to a physician, love physicians, and medicine is important. Why do I have to give this disclaimer? But something that kind of bugs me, and I love the things like the culinary medicine initiatives, right? But often I think like our grandmothers, I'm pretty sure, knew that you had to, eat your vegetables. Like those are not, we're not talking about rocket science here, right? And sometimes it just angers me that we have to use precious healthcare dollars to get physicians to learn that you have to eat your vegetables and to
Right.
tell that to other people. Like, how come can't we rely on historic common sense? But I guess there are people out there who think that maybe vegetables are less important. I understand the whole historic reliance on meat, and in particular dairy, as a part of the industrialization and the urbanization of society, and how really there was no global food chain to distribute produce 100 years ago. And yes, I'm quite sure that having access to dairy near the cities did help with the survival and preventing stunting and all those things. Eggs, sure, okay, but we're 100 years ahead now, and can't we just go back to some basic common sense and just eat your broccoli? And why do I have to pay a physician to tell me that?
Yeah, Rochester Medicine has a great new poster. It's ask your doctor if a healthy diet will help you.
That's such a good one.
Yeah, I'll share it with you.
Yes, please do, and we'll share it broadly on social media, because
Sure.
it's, I mean, as Dr. Gregor likes to say sometimes, big broccoli
I love it.
is not sponsoring a whole lot of people. In Canada, we do have the, I guess, Produce Manufacturers Association or something like that, that are somewhat active, but they probably have a marketing budget that's definitely peanuts compared to the maple leaf foods of this world.
Exactly. Yeah.
So a lot of work ahead of us. Let's shift gears a little bit. I'd like to know how you make whole foods plant-based eating work for yourself. What are the boundaries you set? What do you consider to be really good food in your life? And how do you manage to make it happen onto your plate?
Right. Well, so I mean, I've learned a lot from you, and I love your batch cooking suggestions. I look at your biweekly food plans. I can't say I follow them, but I consider them as useful input. So batch cooking for sure. Batch cooking in a freezer. Fantastic, right? Those two things just make all the difference, because I would say when I first started, I was really interested in learning to do new recipes and, learning to make things that were really satisfying. And I'm always experimenting. I mean, I'm lucky in that I love to cook, and I like to I have enough time on weekends to devote time to cooking. So I even batch cook oatmeal. I do. I often make Ann Esselstyn's savory oatmeal, which has kale and sun-dried tomatoes and turmeric, and it's a fantastic way. So batch cooking is one thing that makes a huge difference. I would say since I'm back from the Esselstyn retreat, I'm relying much more on simpler approaches. Throwing together a bootable, I still, that still requires me to batch cook some rice or a grain, chop up as many vegetables, and have them ready to go. So, I try and make sure that things that I buy get used by making them easy to cook. So I probably spend much less time than you do cooking each evening. I often throw together a Buddha bowl. On the weekends, batch cook a sauce or two and throw it in the microwave. So, I try and get a variety of fruits and vegetables every day. And I use a lot of microwaving with all the batch cooking I do, and advanced preparation. Yeah.
That is key. Having, I call them the major building blocks, right, of dinner ready-made. And I'm less of a bowl person. I prefer to have things warmed up and feeling like they're cooked, but it's the same idea. I think most of the dinners I do are thrown together from what's in the fridge.
I do bowls warm.
Yeah.
So
nice.
I throw in some grains, some beans that I have on hand. I 2 or 3 different vegetables, some nuts and seeds, and warm it up. So it's a warm. I'm not good on salads in the winter, but
me neither.
So try and introduce as much variety of vegetables and fruits as possible during the week is another approach I take. So it's warm, it's satiating, satisfying, and so I found a way to, with even less work in the evenings, find a way to do this.
I love it. Tell me a little bit about your food rules. Do you have any? Are there boundaries to your diet other than being plants? But
I try, and I like the term plant strong that Rip Esselstyn uses. I really do like the whole food, plant-based, low salt, oil, and sugar approach. So I aspire to that. I will say that sometimes I deviate if I'm out for dinner. If I do have a hankering for chocolate every once in a while, trying to manage that is challenging, and occasional ice cream. So I do deviate, and so I'm not perfect, but it's really, I'm plant strong. Most of my food is strong food, and it helps me to think that way.
I love that. And I have to say, I mean, cacao is a plant.
Yeah, I know, but
I mean, it's possible to get chocolate that is largely cacao or cocoa at that stage, rather
dark chocolate. So, dark chocolate.
Yes, exactly. There's
absolutely.
very good options. That's definitely on my list of allowances.
It can be very addictive, though. It can be very addictive. Yeah.
I have a history with caffeine. Some may know that I quit drinking coffee. I actually had a blog about coffee in Montreal back in 1995. So I was a true coffee lover. And I completely quit coffee about 12 years ago now, because I was suspecting it might have something to do with miscarriages that I was experiencing. It may or may not have been the case, but I never had a miscarriage after. Who knows? But the thing was, when I was not drinking coffee every single day, I would inevitably at 8 o'clock in the morning, if I didn't have a coffee yet, I would have a headache, and it would last all day. Even if I had coffee later, like it was done for the headache was in, and that was that. And I'm finding that chocolate, if I have it on a very regular basis, it will do the same thing to me. So it is powerfully addictive.
Oh yeah. I gave up caffeine in coffee as well several years ago and went through withdrawal. It was painful. I've decided I'll never do that again.
Oh yes. It was the worst month of my life by, hands down. It was just terrible. But once it was over,
you feel so much better.
It was amazing. And I'm so sad because coffee smells good. And yes, of course, it does have some health benefits. But I like to tell my husband is still the coffee drinker. But I like to tell him, when you look at those studies about those people drinking coffee, well, maybe it's the only fruit that they have, or bean that they have in their whole diet. So and chocolate is the same, because there's so few people that eat a substantial amount of fruits and vegetables. So I think I'm making up for what I'm missing from the coffee by eating.
But it must be hard to deal with that beautiful scent every morning.
Not anymore. I like the smell, but I don't like the taste. Actually, the other day we went to the coffee shop, and my daughter ordered a chai latte, the tea with the oat milk, and she tasted it and she was like, "Ew, that's coffee. It's not the tea I ordered." And I was like, "Really?" And I tasted it, and indeed it was a coffee latte. They messed the chai word in there. And so I drank the thing, and I drank like a quarter of it, and I didn't like it. Coffee drinking is an acquired taste. Like you remember when you were 10 years old, you probably didn't like
Right.
coffee.
Right.
And then, it's like the grown-up thing to do, right? My
Right.
brother would always tell me the kids drink milk and the adults drink coffee, right?
Right.
But once you let it go, it's like, actually, it's not that great.
Well, and I think there's an analogy with the change in our taste buds when we go plant-based, that, for years we've been overstimulated with these powerful addictive substances that the food industry puts in our processed foods. And we're used to this high level of stimulation. So when you first go plant-based, it just seems so bland. But after a while, you start tasting these rich depth of flavor in just fruits and vegetables that really makes a difference.
Absolutely. And I mean, we don't even need to blame the food industry, although there's a lot of blame to go around there. But things like Parmesan cheese, like the traditional Parmesan cheese, and my personal thing was blue cheese. I loved blue cheese on a rare steak, right? When I was an omnivore. And believe it or not, I went away from that. But those were not, industry-driven foods originally, at the very least, but they were bombs of
flavor bombs
with a lot of fat and a lot of salt, and it just talks to our primal brain and tells you need
instincts.
this.
Our survival instincts are activated.
But I have good news for everybody listening to this. There is more likely than not a grocery store that you can access a lot of foods that are really excellent for you, and you do not need the Parmesan cheese, which, by the way, for vegetarians listening, is not even vegetarian. Parmesan has rennet in it, which makes it non-vegetarian. It always shocks me when in a restaurant, there's the vegetarian option has Parmesan. I'm like, no,
right,
it's not vegetarian. Okay. Let me ask you to conclude, Charlyn. There's people listening that maybe have had the same habits for the past 60 years in terms of their diet, and they're maybe in the pre-contemplation or contemplation stage about, obviously they're listening to the Vegan Family Podcast, so they're thinking about, what is this vegan thing? What if I could go plant-based, but it's good for others, but Charlyn can do it, but not me. What do you have to say to them?
Well, I'll even say, as a vegetarian, for the longest time, I couldn't imagine what one would eat on a vegan diet. It seemed to me it would be all rabbit food and boring, right? And so it really took me some real change in my thinking to imagine that I could be really happy without eggs, cheese, as those flavor bombs. And so that, I'd say there is hope. And it's, I think it involves a mindset change and open to possibilities. And I just think there's so many blogs and, inspiring recipes on the web. There are all sorts of things to inspire you. So I really think getting inspired, maybe, and I know your new book is about flow in the kitchen. So I'd say before you do that, really get inspired by buying a couple of great recipe books. And
you are a cookbook fan. I know that.
I am a cookbook fan. I get inspired with cookbooks and recipes, just with new ideas. So either on the web or, thumbing through books that will inspire you about what's possible and help you learn. Because I really do think it's helpful to learn a new way of cooking and a new way of thinking about food, that it's not, meat and a vegetable by the side, right? That it's a totally different way of approaching food and cooking. So I'd say, read, look for great websites on the web. And I think your blogs and your advice is great. There are many more. The other thing, if people can afford the time and the money, is if you can do a retreat, man, is that a great way to jump in. I will say that I went to one of the Esselstyn retreats with a friend who knew nothing
Oh,
about,
really?
knew nothing about it. She just decided, she'd come with me because I was talking this up. But she really didn't know the difference between vegan or whole food plant-based or anything. And we went to a retreat in Sedona. She came back, she'd drunk the Kool-Aid. She had tools she knows how to cook, and she was able to really figure out how to do this. And all in, she is all in. And I would say even me, I got more inspired and learned some things. I have another friend.
It's the fire, it really
gives
a bit of a boost, right?
Absolutely. And, since that retreat, I've been inspired to try and include greens in every meal I eat, breakfast.
I love that.
Etc. So I think if you can do something like that, it's absolutely fabulous. Or, there are online 7-day immersion programs. There are lots of opportunities, especially this time in the new year. And I'll say I have another friend who expressed an interest, she's in her 60s, expressed an interest in going plant-based because of a health issue, but sort of is in and out of it. And she's on a very different trajectory than this friend who plunged right in. And, I guess my advice would be dive in. Just dive in, try it for a month. You can do anything for 30 days. So dive in, try it out, see how you feel, and you'll figure out ways to make it easier for yourself to do.
I love it. I love this idea of a total immersion. It makes you aware of possibilities. And I think starting with giving yourself this idea that, well, if in 30 days I don't want to keep going, I don't have to. But then maybe I think 30 days is also enough for people who have perhaps some chronic disease that they're struggling with to start seeing a difference. Would you think? 7
days will do it. We see real differences in cholesterol, A1C, markers for diabetes in 7 days. You don't need 30 days, but 30 days is better to give yourself a real time to really adopt habits. So, I think there are debates about whether it's best to start small or to dive in. And I'd say, well, diving in for 30 days is sort of like starting small. It's not for the rest of your life. You can try it out, see what works.
Right. And you can always maybe go back and forth after that a little bit.
Absolutely.
And then, go back to all in over time after that. Yeah. Thank you so much, Charlyn, for this inspiring conversation. I really appreciate your time and your beautiful ideas. And I look forward to cooking again with you, not too distantly in the future. We've done it before and it was super fun. So let's do some batch cooking again one of those weekends.
I'll look
Thank you
forward
for being
to
there.
Okay. Thank you very much.